Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolf, along with the Assistant City Manager Dr. Colleen Bridger, who is the Director of our San Antonio Metropolitan Health District, as well as Dr. Ken Davis, who is the Chief Medical Officer for Christus Santa Rosa Health Center. And this is our COVID-19 update for the San Antonio community. We do hope you had a safe and physically distanced weekend. Tonight we continue with the trend of cases that we've been reporting and are reporting 565 new cases of COVID-19. Which brings the total number of cases to 20,213. We do unfortunately have 11 new deaths to report. 6 of them are Hispanic and 5 were white. 7 were male, 4 were female. Their ages ranged from 40 to 80. And the 5 of the deaths occurred at home, while the remainder were being treated in local hospitals. We've now suffered the loss of 195 San Antonians during the COVID-19 pandemic thus far, and our deepest sympathies are with their families. Our hospital system now is under severe stress. 1,267 people are hospitalized, with 421 in the ICU and 257 on ventilators. We now have 45% of ventilators available and 10% of hospital beds available. As you know, there are 7 progress and warning indicators that we've been telling you about weekly to talk about the where we are in the course of this pandemic, and we've been going through each of them on Mondays. But to simplify it for you, we've created a new risk level graphic that will be an indicator of how our community is doing and what stage of the pandemic we are in. We've combined the 7 indicators into one collective risk level, and we are currently between severe and critical. We are nowhere near the sustained decline in new COVID cases. We continue to have more than 1,000 people in local hospitals, and the positivity rate of COVID tests has increased slightly, now to nearly 25%. The hospital system as a whole, as we said, is under severe stress. So what does that mean for you? The messages have not changed, and if it helps to remember them, they fall under 3 Ps: prevent the spread, protect your family, and provide information. You can prevent the spread by wearing a mask, washing your hands, and maintaining social distance. You can protect your family by staying home, avoiding crowds, and creating closed social bubbles. Again, your household unit. And finally, you can provide information which critically helps us in the fight of this virus. If you test positive, answer the call from the contact tracers and let your close contacts know if they should self-quarantine. And again, these are ongoing guidance from our medical community and critically important for us to protect the San Antonio health and welfare. So I'll turn it over now to Judge Wolf.
Thanks, Mayor. We're going to be in for a good while of tough issues, particularly over the next 2 weeks if we don't get a handle on this thing. And it's not just us. It's every major metropolitan area in the state that's just running about the same thing we are. Even across the nation, you're seeing this continuing to be a big problem in the growing number of cases. But the next 2 weeks I think, are going to be pretty critical to us. And they're a major thing that's about to come about, and we have some concern about, is that on August the 10th, I know that San Antonio Independent School District is going to be going back into operation. I believe it's August the 27th on Northside District. And then you have another 15 school districts in our area that may have different starting times. Now, this is going to be a problem. Let's just take Clark High School. There was some 3,000 students there. A parent has the ability to say, okay, I want my child to go, or I'll take the lessons over the internet. Let's just say 2,500 of them show up at Clark High School, and you got teachers that are going to be in a vulnerable position. That is an incredible thing to try to handle, like trying to herd a lot of wild cats. And most of these students aren't going to have much of a fear. So we hope that the Texas Education Agency will give these school districts some ability to stage and to say how many people ought to be there. If you read any of the governor's latest initiatives, no more than 100 people in one place, even going down to 10, and then we say, 2,500 or 3,000 kids could end up in one school. Hopefully he's going to take a look at this and decide that school districts ought to have some flexibility in determining how many kids will come in at any given time to sort of stagger their classes. And we're hoping that he will do that. We think school districts have the right to maybe delay their opening for 3 weeks, but this is almost on us now. So we're hoping to get some support on that, and we hope that the governor and the Texas Education Agency is going to be paying attention to this, because this could be another big problem already laying on top of a huge problem we've got now with so many social gatherings, so many places where tons of people are coming together, which is by far the most dangerous thing we can be doing. So hopefully, Mayor, we'll get some support on that.
Wholeheartedly agree, Judge, and that is an incredibly important part of us working together to slow the spread of this virus, and how we get back to school is obviously on the minds of parents and our entire community. So we'll be meeting with superintendents this week and talking more about their plans. I also want to make note that in partnership with the nonprofit organization Lift Fund, the City of San Antonio is now utilizing federal funding provided by the CARES Act to provide grants to small businesses and nonprofit organizations that have been impacted financially by COVID-19. The grant program is an initiative of the COVID-19 Community Recovery and Resiliency Plan, and that was approved again by San Antonio City Council last month and corresponds with the Commissioner's Court program as well. The application period is open today, July 13th, 2020, and closes on Monday, July 27th, with $24.7 million made available. Lift Fund will administer the grants, and all completed applications will be reviewed for basic eligibility. Eligible businesses can apply by going to the website covid19.sanantonio.gov/recovery grants, or you can call 1-800-494-4973. Be sure to subscribe to the latest COVID-19 updates by texting COSA.gov to 55000, or you can go to the website covid19.sanantonio.gov. Again, we're all in this together. Stay home, save lives, and if you have to go out, wear a mask. And we're here for questions and comments.
Mayor, you took on social media today talking about the state moved too soon and too fast. If we can't contain the spread, you mentioned you have no choice but to roll back. What does that mean, and what does rolling back mean to you?
Yeah, well, it's clear that the governor is looking at the same data that we are, and it's important that we're de-densifying and limiting gatherings as much as we can. Again, we've talked about mass gatherings being one of the most critical areas that we had to restrict from the start of this pandemic. We do have limits on gatherings now of 100 people. We also have additional restrictions for other gatherings that we can control, but the state's restrictions have exemptions in there that, again, you can drive a truck through, and that's one of the areas that we think needs to be further regulated.
Let me just give you a couple ideas of what the mayor is talking about under those 13 exemptions. Religious services, and we already know that that's a big problem. Just the one church we were reading about here, local government operations, youth camps, recreational sports programs. I would really recommend to the schools that they not do that, particularly football. That's very, very dangerous, and hope they don't do it. That applies also to professional, collegiate, and similar sporting events. I think that's a very bad idea to be doing now. I know I talked to the Bobby Pettis with the Spurs today, and they were thinking about having soccer, but now they've taken that off of the table. And I think they made the right decisions. Water parks is another one, aquariums, rodeos and rodeo events, amusement parks and carnivals. We should not be doing that right now. And that's what the mayor, I know that's part of what he's talking about. And it's just too dangerous to do with what's happening right now.
Mr. Davis, what do you think about maybe rolling back a few things?
Well, I think it's important during this time frame that this disease is still spreading and still killing people. Even those that don't die have an awful, awful course of this and may have long-term sequelae from it. So this is the time, and we love our sports, we love our athletes, we love our gatherings, but it's not worth people dying over.
Some counties here in Texas have received refrigerated trucks in order to deal with the number of deaths. Is this something that's being discussed here? Do we have anything like that here?
So we're always in a mode of preparing for contingencies. So we do have refrigerator trucks on standby in the area should they be needed.
Can you explain to our community what does a refrigerator truck mean?
Actually, probably Dr. Davis would be better to do that.
I'll try. It's a hard thing to talk about when people's loved ones are dying, but in the hospital, there are only so many places to put bodies of the loved ones, and we're out of space. Our funeral homes are out of space, and we need those beds. So when someone dies, we need to quickly turn that bed over. So we've got 2 slots in one of our bigger hospitals for people that have passed. We need more than 2. We had 14 die in the hospital this weekend, plus other non-COVID patients, of course, are dying. So there's nowhere to put them. So we're looking ourselves for refrigerator trucks to put bodies and to hold them until the morgue or the funeral home can come pick them up, which sounds terrible, but it's true.
We have some text questions from Joe Galley with News 4. What is the difference in physical process of taking the antigen test versus the PCR test, and do they both involve swabs up your nose?
Yes, they both involve swabs up your nose. The difference is what you do with the swab after you get it out. PCR tests look for genetic material. Antigen tests look for protein. The PCR tests are what we started out with originally. The antigen tests are more like the 15-minute tests that some of our urgent care clinics are using. Both of them, however, if they come back positive, are equally accurate. If you get a positive antigen test, that means you have COVID-19. If you get a positive PCR test, that means you have COVID-19. What we worry a little bit with the antigen tests is some false negatives, but typically those negative tests, if somebody is symptomatic, will be followed by a PCR test. So folks are familiar with, you go because your throat hurts, they do a quick rapid strep, but they will also send a culture off if it's negative to see if that culture grows. That's kind of the analogy here as well.
Now that Metro Health is adding the antigen number to the dashboard, what have we learned from that, and what benefits could we see in the near future by having this added level of data?
Okay, so I need to clarify that we have always counted the antigen tests. Early on in the pandemic, the state came out with the recommendation that you count both PCR and antigen positive tests because they're very accurate in saying, yes, this person has COVID-19. What we started doing today is breaking those tests out so that people can see the number of antigen tests that are positive versus the number of PCR tests that are positive. We did that because what we're finding is that there's an inconsistency in how this data is being counted across the state. And so we wanted to have both of those numbers to be able to compare apples to apples.
Will the Freeman Coliseum and other testing sites run by the county and the city offer both options, and if not, why?
We have primarily switched over to a different kind of PCR test. This PCR test, so again, remember, PCR is looking for the genetic material. The PCR test that the city is offering at its drive-through and 2 walk-up sites is one that looks for the genetic material by swabbing somebody's mouth after they've been asked to cough a number of times. So that seems to be working out really well. It still takes 3 days to get the results back because they are looking for that genetic material, but it's a little less awful to have that Q-tip shoved up your nose. So long answer to say we are using a PCR test that only involves a swab after you've coughed.
Dr. Davis, we're hearing that some patients with COVID-19 are sent home and are still being monitored. How is that possible?
We're looking to find alternative care sites for people that are positive but need oxygen therapy, but may not need hospitalization. So we're sending people home with oxygen and with oxygen measures, as well as temperature measures. And home care is remotely measuring twice a day their oxygen levels and their temperatures. And if their levels drop below a certain level, even on oxygen, we get them to the hospital. But many can manage at home with home care and oxygen instead of being hospitalized, and that's helped us open up more beds. I think that's one reason we've been able to manage a little more of the surge here.
A viewer wanted to know about sweat and if the coronavirus can be transmitted through sweat. Is this something that?
No.
I'm not aware of the disease, no.
Calvert and others have raised concerns about conditions at River City Care Center. Could you discuss the city and county's response to these allegations, and have any steps been taken to address these concerns?
So first I want to clarify what our role is in the city and the county versus what the state's role is with these nursing facilities. These nursing facilities are licensed and inspected by the state. The city, through its health authority, has given them additional requirements that they have to adhere to during the pandemic that are specific to infection control practices. The majority of the complaints that we've received about River City fall into the state's jurisdiction. They are concerns about quality of care rather than about infection control practices. So while we partner with the state, when they go out, we go out. What we look for is, are they wearing their PPE? Are they taking care of making sure that infection isn't being spread from one person to another? The state looks at what is the temperature in the facility, what is the quality of the food, are there the right kind of sheets on the right kinds of beds? So we do it in partnership with the state, but I know it's really hard for people to understand that the city does not have control over the quality of services that are provided in any of our nursing facilities.
We're hearing today that hospitals are training a new group of nurses and more nurses are coming in. Do we have a total, and do you have any update, Dr. Davis, on Christus?
We do have new nurses coming, which is good. I don't have a total, but we're training nurses today to help. It's been extraordinarily helpful from both the state and the feds. We're not only nurses, but respiratory therapists and others that are coming in to help us.
And I heard these nurses have a lot of experience. Some of them even come from serving in hotspots like New York and in other places, correct?
We're very blessed with these nurses. They are experienced, yes.
We know that local health officials track the number of fire department ambulance runs made to nursing facilities. Do you also track the runs to nursing facilities made by private ambulances?
Not generally. There are a few exceptions to that, but generally no, because what they're primarily doing is transporting non-emergent patients from one location to another.
Just talking to doctors and hospitals, is there any support or any hesitant doctors that don't want another shutdown? Or is there any feedback on that? Maybe rolling back?
I'm not understanding your question.
Are doctors and hospitals here after conversations, are they in support of a full shutdown? Have those conversations been discussed?
I mean, we're in communication with our doctors and medical community on an almost hourly basis, and so they're keeping us apprised of where we are with regard to capacity issues, and they see the data just as we do, which is that, you know, we're getting close to at max capacity. We're at 10% of staffed available beds. We're at, 45% of available ventilators. And so we've got to do everything we can as a community to, flatten and ultimately lower the curve. And that's incumbent upon every one of us. If there was an easy way to do this, we've already done it. But it's going to come down to all of us maintaining the behaviors that our public health professionals have stated, and we're going to do what we need to do to limit the high-risk activities like mass gatherings and other activities that are prone to disease spread.
Here's a question from Patty Santos with KSAT. If the governor gave counties the ability to make the decision on another stay-at-home order, what would that look like in Bexar County? Would it be a full closure such as the one in March?
You want to take that?
Well, I think we're pretty close to each other on what we're thinking. We all believe that that first phase that the governor did in opening was okay. And there were the ones that he did after that relate a lot to what I was talking about just a little while ago. There's the question, he did dial back on restaurants from 75 to 50%. I guess it was retail 50 also. I believe the mayor and I are pretty close on that. Basically going after trying to stop a lot of these mass gatherings that can be extremely dangerous. I believe we're pretty close.
Yeah, and I'd say, I mean, the evidence is pretty clear at this point. We opened too fast and we opened too soon. And so I think the rollback that has been done already was a step in the right direction. I think there are some further rollbacks that we need to do with regard to mass gatherings and other high areas of high congregation. And then we've got to, enforce these mandates such as physical distancing and mask wearing. But if these numbers continue in the same direction as they have been over the last couple of weeks, we're going to be forced in a situation that nobody wants to see, which is to shut down activities. We can stop that if we work together.
I think both our police department and the sheriff's department needs to step up citations. I talked to the sheriff on that today. I said, look, you've gone out there, you've warned people, you've visited with them. I said, you need to go back now and you need to start it. Whether it's a $1,000 fine for a business that's not complying or whether it's a $250 one for citizens not doing it. The governor asked us to do that, by the way, just 2 or 3 days ago. So I think we do now need to, we've done enough warnings, we've talked about it enough, so I think they need to start giving citations.
Thank you.
Thanks, everybody.